Yeah, maybe next, after the next talk, please. We go on to Dr. Aniruddha Maiti. Is he around? Yeah, perfect.
Thank you, madam. My presentation is visible?
Yes.
Yes, it is.
Perfect. Yeah.
At the outset, I would like to thank AIOS and Novartis for giving me this opportunity. Well, I will be sharing my experience with this new molecule. Coming to the first case, 68-year-old male patient and medico himself had a blurring of vision since last 5 months, and the vision on the right eye was 660 and the left eye was finger counting to fit. And the dilated fundus examination showed that it was a case of a bilateral CNVM case, and as you can see in the OCT, this was the right eye, and the left eye, you can say the shrimp-like structure. So what we counseled in the left eye, as it was not prognostically very good, so we advised him ACCENTRIX in the left eye. And the right eye, he was given a choice of AFLIBERCEPT or brolucizumab. And he being a medico, he actually decided for the newer molecule, going through the literature. And luckily, it was a very dramatic response. We got a very dramatic response after a month after giving the PAGENEX on the right eye. You can see the lesion has subsided, the size of the lesion has come down, and the vision has improved from 660 to 636. And the left eye, as we were discussing, it was not prognostically good. The fluid has definitely come down, but the vision was unchanged. And as there was a lot of discussion before this presentation, loading dose, to give loading dose or not, but actually we followed Hawk and Harrier, and we followed it was a treatment naive patient, so we followed the monthly loading dose. And this was the picture in the right eye after the second dose, and vision further improved to 624. We didn't give any injection in the other eye. And this is after the third dose. The patient actually did pretty well and was so happy. For the first time, the CNVM patient was so happy. And the left eye, he actually insisted me to give one injection in the left eye. It didn't change much, but he was symptomatically better. So if I summarize this first case, treatment naive patient improved from 660 to 618 after the loading dose. Coming to the second case, this was a 56-year-old female patient, had a sudden dimness of vision for a week's time. Right eye had a subretinal bleed. Seeing the OCT, it was suspected to be a PCV bleed. That time in the COVID times, we are not going for the invasive test. And by this time, we had a little bit of experience on the PAGENEX. I decided for injection PAGENEX. And this patient was outstation patient, so I actually called her for in the first week itself. In the first week, actually, it showed there was the reduction of the subretinal blood has started. And also the height of the PED has come down. And the vision improved from finger counting to 1/60. And this patient, when came after a month, it improved further to 660. And this patient also, we gave a loading dose. This is after the second dose. You can see the PED height has decreased and patient was symptomatically much better. And this is the summary of the second case, treatment naive, or most likely a PCV bleed, improved quite a lot. And the vision 636, we are waiting for the third month visit. Coming to the third case, this was a 62-year-old male patient, had a dimness of vision for 2 months. Left eye had an active CNVM or a PCV. We'll come to it why there was a query. This was a picture. This was in the month of June. And after 3 loading doses of ACCENTRIX, it responded pretty good. And the vision improved to 618. But after the third dose follow-up, 6 weeks following that, there was a recurrence. And you can see there's a notched PED. So most likely it can happen as an PCV lesion. And this time we actually switched therapy from ACCENTRIX to PAGENEX. It responded pretty well. This is after 4 weeks giving the first dose of PAGENEX. So this is the summary of the third case. Recurrence after 3 loading dose of ACCENTRIX, responded well with PAGENEX. Fourth case, 64-year-old female patient. This was also bilateral CNVM. The right eye was scarred CNVM with SRF. The left eye had an active CNVM. The right eye, 1 dose of ACCENTRIX was given, and the left eye, 3 doses of EYLEA was given. This was at presentation, and this is after the loading dose of EYLEA. But actually, the vision improved to 612, and she was doing fine. We were doing a follow-up, and this happened exactly like the earlier case. After 6 weeks of the third month follow-up, third dose follow-up, there was a recurrence, and the vision dropped down to 660. Now we switched to PAGENAX, and it responded pretty well. The vision improved to 612, and we were following every month. And at third month, to be specific, 11 weeks, the SRF had started coming in, and we gave the second dose, and the vision improved by a 1 line. So this is the summary. This is after the second dose of PAGENAX, when there was a recurrence of the 3 doses of AFLIBERCEPT. Coming to the last case, this was a 78-year-old male patient. Left eye had a scarred CNVM, and the right eye, the CNVM was responding to treatment, but there was a recurrence like 4 to 6 weeks. We had to give an injection of AFLIBERCEPT. So this was the picture. The vision dropped to 618 after 7 doses of AFLIBERCEPT. This was 6-week follow-up on the last injection of AFLIBERCEPT. We decided to give brodizumab, and it responded well with the improvement in vision. So this is the summary of the 5 cases. The first one was the treatment-naive CNVM. Second one was a PCV bleed. This was also treatment-naive. And the next 2 was recurrent CNVM post-Lucentis and a recurrent CNVM post-Eylea. And the last one was refractory CNVM. All the scenarios actually, the PAGENAX worked very well. This is the entire list of the PAGENAX which I've used till date. It's more than 50 patients, and mostly CNVM and PCV, few off-label indications of BRVO and DME. As far as the Indian experience goes, total number of procedures is already 3,000 plus. There is 19 IOI. Most of them are mild, responded with the steroids. Only 1 serious adverse effect, which has been already published in IGO. An indication used mostly are AMD and PCV, and few off-label use of DME, BRVO, and CRVO. So coming to the take-home message, with this new molecule actually showed a dramatic response in drying up the macula, whether it was a subretinal, interretinal, or a PED or a central macular thickness. And obviously it was